So first, the update to our travel advisory. We have added an additional 5 states and 1 territory to the travel advisory. That brings us to 19 states and 2 territories marked in orange on the map here that are now on our travel advisory. The 5 states that were added were Georgia, Hawaii, Kentucky, South Carolina, and Utah, as well as Puerto Rico. As a reminder, we've been using the same thresholds for our travel advisory in order since the beginning, when states reach the threshold of more than 15 cases per 100,000 per population. As a reminder, people who are unvaccinated, who are traveling from one of these orange states or territories, should be getting a negative COVID test before arrival in Chicago, or should be quarantining upon their arrival. Also, as a reminder, all travelers must adhere to the federal masking requirements on all forms of public transportation. So that means the L or the CTA bus here in Chicago, that means any of the Metras or the Amtraks, that means long distance buses, that means planes. You must wear a mask, everybody over the age of 2, regardless of vaccination status. That has not changed and remains in place. So if we look in a little more detail at what COVID-19 is looking like across the U.S., this is showing the average daily cases per 100,000 population in the past week. So you can see Chicago and Cook County remain at that lowest level still, fewer than 10 cases per 100,000 in the lightest yellow. But the reason you've been hearing in the national news a lot of stories out of Louisiana and Florida and Arkansas is that they are seeing some COVID surges there that are as bad or even worse than anything that we saw here in Chicago, and that is largely because vaccination rates are low. Here's what hospitalizations look like, and similarly, you can see we remain, not surprisingly, at the lowest level there, but in some of those same areas, seeing some very high hospitalization rates. Jacksonville, Florida, for example, is at more than 80 hospitalizations per 100,000. That is higher than we ever got in Chicago. The highest we ever got here in the first peak was in the maybe 65 per 100,000. And unfortunately in Jacksonville, they've only got about a 42% vaccination rate. And so unfortunately, some of these stories that you're seeing of surging and hospitalization is true, and it is landing heavily on unvaccinated people. Here's where we are in Chicago. Our COVID-19 cases are now averaging 234 per day. That puts us in the substantial transmission range. Our other metrics all remain at the lower transmission risk. So we're at a 3.3% test positivity. There are 125 folks hospitalized with COVID across Chicago's hospitals, and 42 people in the ICU with COVID across the hospitals. We shared these graphs previously, but to put it in some context, these case rates that we're seeing, although they are rising, are better really than we have been at any point prior to the vaccine being available, and 99.9% of vaccinated Chicagoans have not been diagnosed with COVID-19 since being vaccinated. We're hearing a lot about breakthrough infections. I know people are concerned about them. We're investigating them and following them up, but 99.9% of those of you who are fully vaccinated are not having breakthrough infections. Similarly, we look at hospitalizations. Those also remain broadly at the lowest level, as you can see that they've been since the beginning of the pandemic. We're averaging right now approximately 9 new hospitalizations a day. And again, 99.99% of fully vaccinated Chicagoans have not been hospitalized with COVID-19. And then finally, deaths, where you look on the right, again, you see these are at rates that we were just wishing for before a vaccine was available. We're currently averaging 1.1 COVID deaths per day here in Chicago. And again, 99.999% of vaccinated Chicagoans have not died of COVID-19. And since going back to January 2021, 97% of our deaths and our hospitalizations from COVID have been in people who were not fully vaccinated. Definitely cases are on the rise. The Delta variant is here. We've been watching it rise over the last few weeks. I expect that to continue. And being vaccinated is by far the most important thing to protect yourself. But while we get through this Delta surge, as a reminder, we're asking everybody, regardless of vaccination status, to put that mask on when you're indoors. I also just wanted to highlight some of what we're seeing in our riskiest settings. So our long-term care facilities, our skilled nursing facilities, have been the highest risk settings throughout all of COVID, more than 1,000 COVID deaths associated with these facilities. But in the past 6 weeks in Chicago, 0 COVID deaths have been traced to a long-term care facility. And that's because residents are very highly vaccinated and staff are relatively highly vaccinated, although we still have a ways to go there. In the past 2 weeks, though, we have seen 14 new healthcare worker cases at 9 skilled nursing facilities. 79% of those cases are not fully vaccinated. And so I want to give a special ask to people who are working in healthcare settings, whether that's long-term care, whether that's outpatient, whether that's hospital settings. Now is that time to get vaccinated. We don't want you at risk as COVID is on the rise, and we really don't want you putting patients at risk. I was on Facebook this morning sharing some new data out of Israel, just highlighting that where they were seeing breakthrough infections in healthcare workers, these were all coming from exposures to unvaccinated, either members of their household or patients in the hospital. They remain rare. The vaccine continues to work as expected, but in these higher risk settings, getting everybody vaccinated is critical. Also, we will be updating these every week. This is just, again, showing the updated numbers on what we're seeing for cases in red. This marks our weekly case rates for unvaccinated Chicagoans going back to March. So you see that small surge we had in April and May, and then now we're seeing those numbers go back up again. In comparison, the dotted blue line are people who were partially vaccinated, meaning 1 of 2 doses, and the blue line are people who are fully vaccinated. So in that surge in April, we saw just a very small increase among people who were fully vaccinated. The huge majority of those cases coming from folks who were unvaccinated. And as we're starting to be on the way up here, that same pattern is holding true, where the great majority are in folks who are unvaccinated. Similar pattern we're seeing for hospitalizations. Again, red, people who are unvaccinated, blue, people who are vaccinated, and then for deaths as well. So not seeing anything unexpected. Please get vaccinated. I do also just want to highlight as a comparison that there are many places around the world that have seen the Delta surge before the U.S. So we were able to see in India, for example, where vaccines were not widely available at all, how dangerous this virus has the chance to be. But in settings where vaccines are quite widely available, like the United Kingdom, their surge really has already happened. You can see there on the top, that's showing this major surge in cases. This shows from September through July, so you can see they had a similar peak that we did in January, and then they had a peak in cases as Delta replaced that was almost as high in terms of cases. However, look at those 2 graphs on the bottom, same time frame, September through the current. In comparison to the high number of cases, the number of hospitalizations much lower, 1/15, and the number of deaths, see how much lower that is compared to previously? That is because of the effect of the vaccine, and they are very, very, doesn't matter what vaccine you get, seeing most of those severe outcomes on people who are unvaccinated. And then here around the U.S. too, where there are places that are surging a little bit before us. This happens to be out of San Diego, but I just want to give you the sense that this is nothing different, where that blue dotted line shows you what COVID rates have looked like in San Diego, all county residents, but the orange line shows you what the cases look like among people who are not fully vaccinated, and the dotted green line shows what looks like among people who are fully vaccinated. So we are looking at this data. We'll continue to update about it, but the most important thing, if you're worried about COVID, is get vaccinated, and the second thing is just asking folks, for now, while we get through that surge, to keep your mask on. Getting a lot of questions about return to school. I just wanted to remind folks that, for example, as we return to Chicago Public Schools for in-person learning, there remains a primary focus on safety. Different than all of last year, of course, we now have vaccines available for staff and students who are over the age of 12. That is a huge help in terms of limiting the risk to adults, but also potentially the risk to students from adults. CPS continues to work hard on getting folks vaccinated, but it's not like vaccines are the only thing. Before vaccines were available, we saw all through last school year that we could have school in person without major risks of COVID outbreaks. We saw that first with the Archdiocese. Schools here in Chicago were open nearly throughout the whole year last year at nearly full capacity. And then later in the year, similarly with Chicago Public Schools. All of that was before vaccines. And for CPS, they're not taking things away in terms of what was already done to have safety there. So just to remind you about that, because we've been getting a lot of questions from parents, CPS alone put more than $8.5 million into HEPA purifiers, which are these purifiers that can filter more than 99.99% of airborne viruses. And the district has spent more than $70 million on upgrades to things like air handling systems, specifically to make sure that settings can be as safe as they can be from a ventilation perspective. It's a big expense, but it's good for COVID. It's also good for the long term. I'll send you to cps.edu/air quality if you want to read more about that. Face coverings will be required and provided for all staff and students, required at all times, at least as we start school. That was a strong recommendation from CDPH, and we're pleased that that's what they're doing. They will continue doing the same community notifications, contact tracing, case investigations that were really at the cornerstone of the work that we did last year, and we have continued to coordinate with them. There's also much more testing availability. There's significant money available from the federal government, not just for CPS, but for all of our schools. So widespread testing availability. Again, one more piece of mitigation to make sure our kids can be back in person. And then daily screenings. These will be daily risk and symptom self-screenings. They'll continue to be required for staff, students, and visitors to any CPS buildings. So there's more information at cps.edu/school reopening, but we're less than a month from coming back to school, and I want to make sure people are getting their questions answered related to that. One other thing we've been getting a lot of questions about is Lollapalooza, and I'm happy to take other questions that folks have. But one, we'd heard from a number of folks, how do you know whether people were vaccinated at Lollapalooza? And Lollapalooza itself was the one, they were doing the checking at the gate, and they were also actually keeping track of what percentage of folks that were coming through were vaccinated, what percentage were tested. You had to have a negative test within 72 hours, and then what percent were being turned away. If, for example, they didn't come with documentation, or their documentation showed that their vaccine was less than 14 days ago, or their test was not at least 72 hours ago, they were being turned away. But in addition to Lala's work there, we had these vaccine ambassadors on site, and I've talked a little bit about them, but because questions were coming up, they were on site, talked to thousands and thousands of folks at Lala about vaccine. We're also helping Chicagoans make appointments on the spot if they were in with testing, signing them up for the at-home vaccines. They were also doing some recording and checking with clickers about what were we seeing for the percent vaccinated versus the percent tested, so we would have an independent way of being able to follow up with Lala's numbers. Absolutely consistent. More than 90% of the folks were vaccinated. And frankly, if more than 90% of Chicago or the U.S. were vaccinated, we would largely be putting COVID behind us. So we know a lot of folks did get vaccinated to attend that event. Obviously, we are following up. We will expect to see some cases related to Lollapalooza because there are hundreds of thousands of people who attend that event. But because it's outside, because thank goodness we were requiring vaccine or testing, and because it is largely people who are younger who attend that event, we will certainly continue to update, but that's where we are right now. And I just want to give a quick shout out to one of the performers, Drag King Tenderoni, who did his whole performance. His party was "The Party Can't Start Till We Take the Shot." If you have not checked it out, seeing performances like this was actually some of my favorite part of being there. Lots of kids very excited about the vaccine, and some of that energy is actually important and why I think we are at higher vaccination rates for that age group than a lot of the country. And then finally, just as a last reminder, vaccine remains highly available around Chicago. You can walk into almost any pharmacy. Most outpatient providers have it. Hospitals have it. And you can call 312-746-4835 if you live anywhere in Chicago. We'll schedule an at-home appointment for you free of charge for up to 10 folks. You can get Pfizer or Johnson & Johnson. There is no ID, no insurance, no bill to you. In addition to that, we continue to be out and about across the community in churches, at food pantries, in parks, at CTA stations, at events, and more. And so if you see the vaccine bus out and you're not vaccinated, go ahead and walk right up and we'll take you. With that, I will hand it over to Dr. Luna to do a quick update, and then we'll come back and take your questions. Thank you.
Sí, buenas tardes. Yo soy la doctora Geraldine Luna, soy directora médica del Departamento de Salud Pública de Chicago y vengo a compartir actualizaciones. El CDPH, o el Departamento de Salud Pública, agregó hoy 5 estados más y un territorio: Georgia, Hawaii, Kentucky, Carolina del Sur, Utah y Puerto Rico al aviso de viaje semanal de Chicago. Ahora hay 19 estados y 2 territorios en el aviso de viaje de la ciudad. Todos los estados han superado 15 casos de COVID-19 por día en una población de 100,000 habitantes. Se recomienda a las personas no vacunadas que viajen a estos estados y territorios que obtengan un resultado negativo de la prueba de COVID no más de 72 horas antes de su llegada a Chicago, o que se pongan en cuarentena durante un periodo de 10 días a su llegada. Las personas que estén vacunadas no necesitan ponerse en cuarentena ni recibir una prueba negativa. Como recordatorio, en una recomendación del Departamento de Salud Pública, los viajeros vacunados y no vacunados por igual deben usar máscaras en entornos y ambientes interiores mientras estén en Chicago. De manera abrumadora, los estados con las tasas más altas de casos de COVID-19 también tienen las tasas o algunas de las tasas de vacunación más bajas registradas. Lo más importante que se puede hacer para ayudar a detener la propagación del COVID-19 es la vacuna. Repito, sigue siendo la vacuna nuestro más preciado tesoro. El aviso de viaje de Chicago continuará actualizándose todos los martes y el Departamento de Salud Pública continuará monitoreando de cerca la propagación del COVID-19 en otras regiones del país. Para obtener más información sobre esto, acuérdense en visitar chicago.gov/coronavirus. El CDPH continúa revisando los eventos de vacunación de toda la ciudad, distribuyendo información a todos los que vivan en Chicago. Se ha administrado más de 3 millones de vacunas a los habitantes de Chicago. Las vacunas son seguras, efectivas y completamente gratuitas. Acuérdense que las leyes federales requieren el uso de máscaras en edificios públicos y gubernamentales, como los hospitales y los transportes públicos. De no cumplir con ese requerimiento, estarían infringiendo la ley. Es necesario. Y hoy, para seguir con los casos de COVID-19, lamentablemente tenemos 234 casos por día y siguen aumentando. El alza no para, pero nuestra positividad sigue siendo de 3.3, se encuentra en el nivel bajo, y las hospitalizaciones también siguen todavía en el nivel de riesgo bajo. Ahora, Chicago automáticamente asume y se alinea con las recomendaciones del CDC por el riesgo sustancial de contraer COVID-19. Es importante recalcar que 99.99 de las personas vacunadas no se han infectado con el COVID-19 ni han requerido el uso de hospitalizaciones, para que veamos lo poderosa que es la vacuna. Y 99.999% no se han reportado muertes en personas vacunadas relacionadas al COVID-19. Siguiendo esta misma línea, 66 casos se reportaron con COVID-19 en las casas de hogares o de cuidado a largo plazo. 79% de esos casos se registró en personas no vacunadas. La vacuna protege y salva vidas. Es importante recalcarlo. Y ahora, hablando del regreso a la escuela. La vacunación para los niños elegibles de 12 años o más está disponible. Es gratis, no requiere identificación ni documentación y sigue siendo el arma más poderosa para contrarrestar esta pandemia. No se olviden de mandar a sus niños protegidos a su salón de clase. El enmascaramiento es otra de los protocolos de seguridad y mitigación que van a estar requiriendo los planteles escolares de la CPS. También se van a estar poniendo en vigor sistemas para mejorar significativamente la ventilación con filtros EPA. Hay rastreos de casos. Las pruebas de COVID-19 van a estar ampliamente disponibles y van a haber cernimientos para asegurar que las personas con COVID-19 no estén adentrándose al plantel escolar y mantener a nuestros niños saludables y, sobre todo, para bajar la mortalidad de los casos. Otra vez reiteramos, la vacunación es la primera línea de defensa para mantener a toda nuestra comunidad protegida. Y la vacunación en el hogar está disponible y ha sido ampliada para todos los habitantes de Chicago a través del Protect Chicago Plus. Se pueden vacunar en su casa hasta 10 personas, recibiendo la vacuna Pfizer si tiene 12 años o más, o Johnson & Johnson si estamos hablando de 18 años o más. Para esta información, siéntase seguro de llamar al 312-746-4835 y una persona le va a coger el teléfono, una persona hablando su idioma en una cultura que uno la pueda entender, si quiere hacer cita. O también puede visitarnos a nuestra página web de chicago.gov/@home y puede hacer su cita y obtener más detalles sobre lo que es vacunación en la comodidad de su hogar. Esto sería todo y gracias por recibir esta información.
Thank you. Questions?
Good afternoon, Dr. Arwady. I have two questions, if you don't mind.
Sure.
The first question is, we've already begun to see several Chicago businesses, restaurants especially, making the decision to only admit customers who are vaccinated. And today, we saw the mayor of New York City announce that anybody who wants to dine indoors or go to a gym has to be vaccinated. Are we thinking this is a move that will need to come to Chicago as well?
Yeah, so a couple things on that. One is I've been really pleased to see restaurants and bars in particular make that decision. We've been keeping a list, and it's a big list, all over this city of taverns and nightclubs and bars and restaurants that have made that decision. And I want to thank them for doing that. It is clearly one of the most important things that they can do in terms of reducing the risk for everybody in the restaurant. I was also interested to see New York do this today. I think that focus on the restaurants and the gyms is not accidental and certainly makes some sense because we know that those are two settings that generally are somewhat higher risk than others. Restaurants and bars, simply because to eat or drink anything, you have to take your mask off, and we've seen transmission in those settings. And gyms, because people often also with exercising don't feel as comfortable with the mask, but also they're exhaling more, and we have seen outbreaks in indoor gyms, including here in Chicago. And so thinking about some of the higher risk settings, I certainly think that those are the appropriate ones to be thinking about. I'll tell you, in New York City, there's a couple things that are different. One is I think they have embraced this vaccine passport idea a little bit more than has been embraced here in the Midwest and across Illinois. We've been working with the Illinois Department of Public Health to make it easier for people to be able to access their own vaccination records, thinking about some behind-the-scenes work to be able to have a more standard way of people to be able to show proof of vaccination, for example, because I do think where you're thinking about doing some of this potentially at a larger level, you want to make sure that it can be operationalized in a way that makes sense. So right now, where folks are looking at their cards and doing that, I love it. Thank you, to make that decision, and we want to support businesses. It's a really big decision to try to impose something like that on an entire sort of class of businesses. And my hope would be more that people who are taking COVID seriously would actually want to go to businesses that have made those decisions. And so we will be celebrating, just as we've celebrated the healthcare facilities that have made that decision to make vaccination a requirement for their staff. I think people who say, we are fully vaccinated. There's a dentist near me that's got a big sign up. My whole staff are fully vaccinated. Let me tell you, that's where I want to go to get my teeth checked. And so I think at this point, certainly we're interested in this. we'll be watching to see how this plays out, but we don't have a current plan to do something like that at the city level. We're working on the tech piece that will help businesses who may be interested in this, and then obviously are in full support of higher education settings or health settings or business settings that make that decision, as long as they're able to operationalize it.
So not ruling it out, but for now, no plans.
That's correct.
And the second question, Dr. Arwady, is with this Delta variant surge that we're seeing specifically in unvaccinated communities, have you seen that that has motivated more people to get vaccinated in those low rate zip codes that we keep talking about?
Yeah, it's a good question. This is one of the things that our epidemiologists have been looking at, and we've actually been, when we're making appointments, when we're doing vaccines, we've been trying to ask folks sort of what is motivating them, to get the vaccine. Is it risk to themselves? Is it risk to others? Is it a requirement for a setting that they're going to be in? We've seen, what I would say is we've not seen a big increase at this point. Our numbers are flat, more or less, over these last few weeks. They've ticked up just a very little bit. Anecdotally, we have heard some people saying, I think it's time to do it with the Delta variant. I can tell you that in some of the highly unvaccinated parts in the South, for example, they are starting to see some more uptick there, which I'm glad of, because the risk is really high there. So part of the reason you're hearing us out a little bit more and sort of sharing a lot of this information again is that I just want to prevent, I've got no agenda except to prevent COVID infections and especially hospitalizations and deaths in Chicago. And people making that decision now helps our surge stay lower. It helps protect people who are too young to be vaccinated or who may be immunocompromised and the vaccine doesn't work as well. But the main thing is it just lets us get past COVID without being hit so hard. So I'd say anecdotally we're hearing a few people, but some of the work that we've been doing with churches, we had a church this last weekend that really did, in Pullman, did a great job of sort of educating the congregation about it, and we did a lot of vaccines on site. Like, I'd love to see, particularly in some of the less vaccinated areas, community groups, block clubs, churches, groups, do some of that collective, let's do this together, get folks signed up, we're happy to bring vaccine, and sort of use this opportunity to say it's been at least a year that we've been following, the safety data is good, and let's not get hit hard again if we can avoid it. Mm-hmm.
Thanks. I've got one for Leor Galil from the Chicago Reader and then a bunch for me. Mr. Galil asks, there's a block of multi-day music festivals that will begin in 3 weeks with Ruido Fest and Lyrical Lemonade's Summer Smash and last until the final weekend in October with Spring Awakening's Autumn Equinox. Organizers of one event, Arc Music Festival, have no COVID safety guidelines at the moment. Will you be working with these events to adapt their protocols to current infection rates, and do you foresee asking any of them to cancel?
So, I know better than from a COVID perspective to try to predict next April, but where we're looking ahead, we continue to really use our local data, our local risk factors. We have seen, it's not that these are just coming, we've had a good number of these events to date, and we've seen a mix of decisions. We saw Pride in the Park decide to do the vaccine checking or testing checking. We saw some of the barbecue ones do that. We've seen some other gatherings that didn't necessarily have that. As rates are going up, depending sort of on the risk factor, depending on whether what's happening around the country, if we're expecting a lot of travelers, there's a lot of factors that might go into that. We are doing some outreach to organizers of some of these events, at least around increasing some education. One of the things that can be challenging is if you don't have, imagine some of these like more community festivals, parades, the same weekend of Lollapalooza, we had Fiesta del Sol going on, which is different in terms of there's not one gate where you're checking people, but a lot of folks are gathering. So it's not always a one-to-one in terms of your ability to be checking all of that. And my bigger concern, to be really clear, around all of these events is not the event itself. The event is outside. There's the ability to distance. My concern is what happens around the event, in the bars, in the clubs, in the parties, in the restaurants, right? Getting back to this point, we really have seen, I mean, think back to, even last summer, there were those big protests. There was a lot of worry. Would we see big outbreaks related to that? We really didn't. And I think with some of what we're learning about Delta, certainly the worry is higher, and I think it's appropriate for the worry to be higher. But we're going to keep following up. We actually have some plans to do some additional likely testing and kind of surveillance around some of these festivals, as are other colleagues around the country as we learn about it. But from my standpoint, if we're not threatening the healthcare system, if there's a highly available vaccine that is highly protective, and people are planning outdoor events, at the moment, we would be planning for those to move ahead, probably with increased messaging, and we may change that guidance if we need to.
Just to go off my colleague's question, is that list publicly available of all the restaurants and bars that are requiring access or IDs to get in? I would imagine that's of public interest for people who are trying to.
Yeah, I think that's a good point. I'm not sure it is centrally collected right now, but I think we could definitely do that. We'd have to work with Business Affairs and Consumer Protection, and obviously I want the business to tell us, right, and make sure they're willing to be listed and all of that. But I think in the same way we've lifted up some of the healthcare settings, I think that's a good idea. So I'll take that back to the team and we'll talk about it.
Now to my very long list of questions. Bear with me, sorry. You said on Sunday that the Delta surge in Chicago was probably going to be similar to the Alpha surge in Chicago in the spring. Can you explain the reasoning behind that? You spoke a little bit to the Delta surge that happened in the United Kingdom. Mm-hmm. I would imagine it's along similar lines about that. It's just I'm having trouble wrapping my head around it because the Delta variant's so much worse than the Alpha variant is.
The Delta variant is more contagious, but we've not seen clear data that the Delta variant is making people clearly sicker or putting them in the hospital more. And we have seen consistently around the world that vaccination remains quite protective, very protective, as we've shown, for those severe outcomes, those hospitalizations and deaths. And so where I look at that surge, and the thing that happens when a new variant, like a very contagious variant like this comes, it outcompetes everything that came before, right? So what happened in sort of April, May, when this very contagious variant came through, it sort of knocked out the rest of the variants and everything almost was Alpha from there. And that is what has been happening over these last couple weeks, and we sort of replaced with Delta. But as we've been seeing these Delta cases, obviously we've been investigating breakthroughs, we've been looking at hospitalizations, we've been looking at deaths here, but then also around the country and around the world, where we have the benefit of seeing how this virus, this variant, is behaving in other settings. And there just has not been anything particularly surprising or concerning about the way that we're seeing those hospitalizations and deaths land on the unvaccinated folks. We're more vaccinated than we were even in that April surge. We've got more people fully vaccinated, so that, at that point we still had a lot of people just with the one dose. And I have not seen any data. And again, we're always just looking and trying to pull in everything we have and make our best assessment, but I have not seen anything that makes me concerned about, for example, overwhelming the health system or the huge number of cases like we saw in the prior rates. And we get more folks vaccinated. Every person we get vaccinated helps keep those curves lower.
I wanted to ask about the rates of vaccination on the south and west sides, because they do strike me as being roughly similar to vaccination rates like in particular like southern states. You said 42% of people in Jacksonville being vaccinated. I don't know if that's all people in Jacksonville or adults, but it's only 30% of people in South Shore who are currently vaccinated right now. I mean, what's to say that it's not going to be as bad, with Delta variant in, mid-South Side or other areas than it is in the South right now?
So some of this is about how geographic do you get. And what you've seen is that we tend to talk about zip codes or community areas. Even with that, within census tracts, there's a lot of variability in terms of what we see. So when we're sharing vaccination rates at the city level, or that's everybody in Jacksonville. Now there are parts of Jackson, if that's their average in Jacksonville, there are parts of Jacksonville that are even lower. And so I'm concerned about places, that are not vaccinated enough. And like we shared, every zip code in Chicago, at least 40% of the eligible Chicagoans, meaning over the age of 12, are now vaccinated. And in all but 6 zip codes, at least 50% are. So I'm very glad we're not sitting with zip codes the 20% like they're seeing downstate and in the South and seeing some real surges. But it's not enough. There will be preventable, largely preventable infections and hospitalizations and probably deaths. And, you know, anybody who knows folks anywhere in Chicago who are not vaccinated, like, you know, now is really the time to do that. But I don't just want to focus on those. I'm also concerned that across the whole city, there's only like 3 or 4 zip codes that are 80% vaccinated among that group. And I would like to see those settings moving, you know, I'd like to see most of the city, if you're at 70% now, let's get to 80, let's get to 90. If you're at 40% now, let's get to 60, let's get to 70. We do that, you know, as a city, we are much more protected.
I want to ask about the Bud Billiken Parade, and we can talk about market days too for the sake of it. I mean, you've got people who are going to be packed along King Drive watching a parade go by. You've got people who are going to be dancing at nightclubs close together this coming week and that kind of thing too. I mean, you've got people who are at Lollapalooza crammed at mosh pits and right up against the stage and that kind of thing. Whether or not they're outside, they're still breathing the same air as the people, you know, who are exhaling inches away from their heads and that kind of thing. Should those people be wearing masks even though they're in an outdoor setting right now? What kind of advice would you give to people in those kind of scenarios? Even though they're outside, they're still in very close proximity to other people.
Yeah, so we'll see. I will say that some of the data that has been the most replicated and the most reassuring has been about outdoor risk. That's not something that we knew last year, but where there were actual studies that were done in the UK as they were reopened. They experimented with having music festivals in different settings and testing people before and after, and really saw outdoor settings, even of this kind of activity, being low risk in terms of vaccine, whereas the indoor is higher. Now, it's not 100%, like, to be perfectly clear about that. And obviously, we continue to learn about the Delta variant, about how it might be showing up differently. And so right now, you know, and some of it also remains at what is our risk here in Chicago, right? As Lala was kicking off, we were at a moderate risk. We've just moved into that sort of substantial risk. Much of the country is on fire from a COVID perspective, to be very clear. And if we were on fire from a COVID perspective, if we were having a lot of the indoor things around it, if it were an event that attracted a lot of older people, we may need to make some different decisions. But I'm trying to, you know, these are big events in terms of a planning perspective. And so, you know, we're trying to let folks know with enough advance notice what we're recommending. My bigger concern, again, are the indoor things that surround some of these events. And so, you know, some of this thought of, like, vaccine or testing to get into indoor could, you know, is that something that perhaps around, you know, festival-sponsored events could be a thing in the future? It might be. We'll see. We're going to learn, because all over the country, people are having big gatherings, often without vaccination and testing, and we will see every case, just like here in Chicago, across the U.S., public health investigates every case. We do the where have you been, where have you traveled, what were your events, what did you attend, and it gives us the ability to really learn about those activities, and we'll adjust, you know, if we need to.
Can you give any sense of timing about when public health may get an answer about the effectiveness of these, like, vaccine, you know, requirements to get into indoor public health settings? I mean, again, people with Delta who are vaccinated can carry the, you know, virus in their noses and mouths.
They can carry it, but I think there was really an emphasis on this with that news, and I know you were referencing the Provincetown outbreak.
Well, I mean, I don't want to go into a bar. Well, I don't want to say that. Go ahead. Sorry.
Yeah. So I think what was sort of lost in a lot of this conversation was that people who were unvaccinated were 8 times more likely to get COVID, right? Like, even in that big outbreak, than people who were vaccinated. And yes, we're learning about the level of COVID in the nose, but there have been a lot of studies that have suggested, even when you look for COVID in the nose, is that clearly, you know, does that mean transmissibility? What does that look like? We're still learning about it, honestly. And I really, the thing that is extremely clear is that the vaccines are working really well. And where people are fully vaccinated, I've not seen anything that has made me change my behavior at this point, except for put that mask on inside while we get through this surge. And all we can say is, here's the data that we have now, here's what the recommendation is, and stay up with the science of it. But again, if a vaccine is available and people decide not to take it at some level, if we're not threatening our healthcare system and there's not a new variant that the vaccines don't work against, it is someone's decision on whether they're going to go into a business, on whether they're going to go to an event, and be unvaccinated and take that risk. And if I don't see that, potentially presenting a very large threat to Chicago or our healthcare system overall, it's a really big deal to say we're going to close things down. It is not our goal or intention. But it depends sort of on what we're doing here, and the way we stay open primarily is getting folks vaccinated.
Thank you.
Mm-hmm.
Hi. Touch on the threshold. Is this working? Yeah. Can you touch on the threshold? And I think you touched on this last week as well, that the mask recommendation would turn into a mandate.
Yeah, so again, this is something that different jurisdictions have really approached in different ways. We decided to make the mask recommendation when we had that first one of our metrics cross over into that substantial territory. The rest all do remain in lower. I think from my standpoint, we wouldn't even consider a mandate unless we moved into at least that high-risk territory. We have not made that formal decision. I think, again, interested in seeing what's happening. And for me, a mandate is also about what is your ability to enforce. And so if we're going to switch from a recommendation to a mandate, that's serious work with the Department of Business Affairs and Consumer Protection. It's about going out. It's the ticketing if folks aren't masking it. There's a lot that sort of comes into that. And again, especially when that risk is mostly on folks who are unvaccinated, it's a little bit of this balancing act. So it's something that we are certainly, it's under discussion. Lots of things are under discussion if or when we moved into that higher risk territory. But that's why we are where we are. And different people are threading the needle in different ways. We'll be watching to see what seems like it makes an effect in different parts of the country as well.
Okay. Yeah, I know you last week sort of forecasted this move into the substantial category.
Yeah.
Do you have any more forecasts? I mean, do you feel like we're going to stay in that category for now?
We are clearly on the way up. Not as a result of Lala, just to be very clear about that. We are on the way up because the surge that we were expecting, is coming. I do expect cases are going to continue to rise. One of the things we're the most interested in is what happens with the hospitalizations and the deaths. And do we see anything concerning related to fully vaccinated people actually, being diagnosed, or more concerns there. I can't obviously completely predict what's going to happen, but based on what we're seeing around the country, right, we're different than at some other points. When these surges come in the U.S., they end up hitting really everywhere, but they hit at different points. And so we have known that at some point, I've been talking to folks around the country all the time, and 3-4 weeks ago, people were like, wow, just wait, right? It's coming. And there's such a desire to try to get folks vaccinated before the surge gets here, before they get scared, or unfortunately get sick. But it's about communication and trying to have people feel comfortable with that decision. We're gonna keep monitoring this. We're trying to be as clear as we can with our recommendations and with keeping the same metrics. I've felt very strongly that we are not altering those. They're the same ones we've been using for the year. And so when we're talking about risk levels, I want it in the context of what the risk has been overall, and the whole game has changed with the vaccine here. We're not done with COVID, but we're not going to eradicate COVID either. And so thinking about how we limit that risk, how we sort of live with COVID, and then attempt to get folks vaccinated and protect people, why I felt so strongly about the masks in the schools. Young kids can't get vaccinated yet. And so it's, right, this is some of the balance where we're making some of those recommendations.
Thank you.
Mm-hmm.
Time for one more? Yeah.
Thank you. If I can just have you clarify, maybe follow up a little bit on your comments regarding the city working on the tech piece that would allow businesses to verify people's vaccination status. Are we talking about Chicago working on a vaccine passport, or are we just talking about a way that businesses can use to verify other than just a card that can be easily
we're talking
counterfeited?
The latter. We're talking about there being more ability for people to be able to, for example, download their records in a formal way, from the vaccine registry that protects their privacy, for example. It's just not something that the state registry had been set up to do previously, and so we've been in good conversations, with the Illinois Department of Public Health. We are not at this point. We don't have a plan for some of the apps and things that are in place in other settings, but I do know, we have a lot of people lose their cards, and we want people where there are settings that are wanting to either mandate vaccine or be checking vaccine as folks are coming in. I want to make that as technologically easy for them as possible in a way that protects everybody's privacy. And there's been a lot of tech work on this done really around the country, and Illinois is also working on that. But it's about trying to make individuals who have been vaccinated, make their lives easier, and make people who want to do vaccine checking, businesses, et cetera, make their lives easier. And that's really the goal at this point.
Great. Thanks, everybody.
Thank you.